Hi, I'm Dr. Srivatsa Lokeshwaran. I am a lead consultant and interventional pulmonologist at Aster Whitefield Hospital, Bangalore. So, a lot of people who come to my outpatient clinic usually ask me what is obstructive sleep apnea, and they are many a times concerned that the partner in the bed or their relatives are usually complaining that they are snoring a lot. So many a times we dismiss snoring as a normal part of sleeping. But to tell you the truth, snoring is the start of a spectrum of a broader disease called obstructive sleep apnea. So what usually happens in obstructive sleep apnea is as we move into deeper sleep, the upper airway keeps collapsing on itself in most of us. And more so as we age and have some associated disease like thyroid disease, or we have a lot of central obesity that is going to tug our neck. So as the airway collapses, we also must keep in mind the oxygen flowing into the lungs also falls short. So as there is no oxygen in the lungs, there is significant fall of oxygen in the circulation as well. So this keeps hitting the brain, and the brain wakes us up from deep sleep into superficial sleep. So because of interrupted sleep pattern, the patient develops something called as sleep debt. So as a result, the patient must complete is 6 to 8 hours of average sleep what a human needs. So as a result, the sleep starts interfering into your daily activities, and in morning hours when you're not actively involved in a meeting or just looking at television, you tend to fall asleep. More so, there are some people who fall asleep on the wheel while driving on the highway, which can be dangerous. And so it also leads to a lot of other medical comorbidities like uncontrolled blood pressure, changes in the heart rhythm leading to abnormal rhythms at night, also putting on more weight, which as a consequence worsens the sleep apnea problem, and many comorbidities that comes along with obstructive sleep apnea. So sleep apnea is an important risk factor for many comorbidities in our life. So how do we recognize obstructive sleep apnea? Usually we suggest to the patient that the patient must get a sleep study done. And once the sleep study done, we then calibrate based on the index as whether the patient has a mild sleep apnea, a moderate sleep apnea, or a severe sleep apnea. Like many diseases in this world, certain problems in our body only have a physical solution and there are no medications. So patients who usually suffer from sleep apnea, we advise a type of device they wear, which they have to wear while they're sleeping at night for minimum 6 hours. It might seem as a hurdle initially when we wear the device. I always reassure my patients that it is just like having power in our eyes. So if you have power and you cannot see well, you have to wear spectacles. And if the patient asks me how long, it is throughout the person's life. So similarly, when they wear the device that blows air into their upper airway and splints the airway open, there is a high chance that the patient does not have fall in oxygen during night. So the patient again is followed up recurrently to see if the patient is complying with the machine and many such technical parameters, so that we keep the patient free of having high risk to developing other comorbidities and keeping the obstructive sleep apnea under control. So if you have any further questions with regards to obstructive sleep apnea, or you want experts to manage your obstructive sleep apnea, please reach out to us at Department of Pulmonology, Aster Whitefield Hospital, Bangalore.